Hey there, psychology students. Professor Zeeb here. In this chapter, we've been talking about substance use and substance dependence. And so, part of the chapter looks at the causes of these problems. If you've been reading the textbook and following along with what the information in Canvas, you've probably seen that substance abuse is often fueled by several factors. Some of those factors have been determined to be biological. Some of them are social and even cognitive. But in this short lecture, we're going to look at some of the psychological dimensions in substance abuse. And really, it's pretty straightforward in terms of applying psychological theory to why people abuse substances. And it's really going to lean and draw back to those earlier chapters in the class where we talked about behaviorism and learning theory and so forth. So it often traces back to that. So let's take a look at some of our psychological dimensions in substance abuse. And like I said, a lot of it's pretty straightforward. Okay, so if you remember back from those earlier chapters, it discussed operant conditioning with Skinner and so forth. And so we're going to really look at that and how that's related. More specifically, something called positive reinforcement. So just to kind of review that, remember positive reinforcement is that a behavior is often increased if it is followed by something pleasurable, right? So in other words, if you do this, then you're going to get this. And we often find that humans follow that pattern in certain circumstances. Well, obviously, substance abuse follows this pattern. It often can be connected to this. So the most obvious part of that is that, if you take this pill or you smoke this substance, you feel good, right? You get a high and you experience this pleasant euphoria or whatever it is. So that is the classic positive reinforcement. You do this, you're going to feel good. And so that's obviously a major reason why people often get high. In fact, if you look at the studies and research surrounding psychoactive drugs, research reveals that pretty much all psychoactive substances provide pleasurable experience to some extent. So that's really been tied to many, many different substances. And so obviously that's why we're talking about it here. Not only that, they found similar effects in animals, not just humans. So in the laboratory, they've tested several animals with different substances, for example. Some of those include cocaine and opiates, and they found that animals will often work to get injected with pleasurable chemicals. So, like I said, cocaine and opiates among them. So we see this also in the animal kingdom where they'll do something to experience something pleasurable, in this case, those chemicals. That being said, obviously social situations play a part in this, not just getting high necessarily, but being in a social situation where people are using substances may be pretty reinforcing for the person, just to be at a party and be part of that experience, let alone getting high. So it gets kind of complicated. It may not be tied directly to the high itself, which often it is, but it could be simply experiencing these social situations that go with surrounding yourself with people who actually participate in those activities. On the other side of the coin, you could also say that substance abuse is tied into this concept of negative reinforcement. So, once again, what that means is that if you do something, it will take something unpleasant away. So, it's different than positive reinforcement. So, in this case, a behavior is increasing in someone, and if they do this something, it takes away something that they don't like. Okay. So, in other words, it'll help them to avoid something unpleasant. Uh, Possibly life situations, for example, or even withdrawal symptoms like we see in alcohol. Okay, so for example, I think it's pretty obvious. A lot of times people use substances to escape life, right? So they're unhappy with their life circumstances, and so this may be a way for them to forget about life for a while. Obviously, feel good at the same time, but to avoid the pleasantness of their life experience. So that could be, stress. It helps them forget or get rid of stress for a while. It could help them cope with trauma, for example. It could lower anxiety. So once again, there's a lot of different reasons where people are using substances to avoid something or to get rid of something that they don't like in their life. So we would technically call that negative reinforcement. The behavior is increasing, and then as a consequence, something unpleasant is removed. Research has revealed that this has been demonstrated in some of our veterans. So veterans often show this sort of behaviors. We see this with victims of sexual abuse as an example, where people will possibly self-medicate to get rid of life's problems or negative circumstances surrounding their condition. So thus, if you look at both of these, they're sort of intertwined in something we call the opponent process theory, which often explains how people get in this vicious cycle of substance abuse. So the opponent process theory basically means, for example, that when you experience an increase in positive feelings, more than likely those will be followed by an increase in negative feelings. So, for example, alcohol is a classic example of this, where someone may have a night of partying, they feel euphoria, they feel great while they're drinking, but then the next day they have the inevitable hangover, which obviously is not fun. So, a lot of times we see that this positive experience is often paired later on with a crash, so to speak, where it feels very negative to that person. On the other side of the coin, you could also argue that an increase in negative feelings is often followed by an increase in positive feelings. So on the other side of the coin there. So for example, alcoholics, after a night of partying, they may be encouraged to have a drink in the morning to avoid a hangover, right? You've probably heard that expression to get a hair of the dog that bit you. This is the classic example of that, where, they're increasing this behavior basically to remove the negative feelings that are associated with a hangover. So, in other words, the negative feelings are often followed by the positive feelings by continuing to drink or to drink the next day. And so you can see why people often get caught in this vicious cycle because they're often intertwined and we see this sort of pattern. After repeated use, of course, abusers experience or can experience tolerance. In other words, it would take more of a substance to basically get the same amount of high that they used to. So once again, it could be that this is contributing to the problem is that uh, the drug use may shift from simply trying to experience euphoria or a high and doing it basically to avoid a crash. So we see this sort of give and take of these two with the opponent process theory, and people, once again, with tolerance are having to use more and more of the substance to get rid of the negative feelings of, dealing with life and not getting as high as they used to, for example. Anyway, that will sort of conclude our short lecture, just, really basic explanations for substance abuse and so forth. So please make sure you go on to the next step in the class and look at some of our other causes in terms of substance abuse.